Hello, this is Dr. Tom Groover. I'm here with Aaron Williams, holistic nutritionist, and we would like to uh, pick up a topic that we've discussed together in the last couple of weeks. And the topic is healing rather than management of conditions. And this is a big issue in medicine now, and it's what the big question which is driving the entire holistic medicine community, and in particular an area of practice which we call functional medicine, and something that Aaron's very familiar with. And so let's first of all start by defining functional medicine. Aaron, what do you think would be a good
Ooh,
place to start there?
that's a good question. Well, functional medicine is going to look at the whole person and the symptoms of the person and try to get to the root cause of what might be initiating some of those symptoms.
Right.
Instead of like allopathic medicine looks at everything in a kind of a myopic view of oneself. So
Yeah.
if you come in and you say, I have pain in my left toe, they're gonna treat you for pain in your left toe. They might diagnose you with gout or something, but they're
Right.
really treating that pain instead of from a naturopathic point of view or a functional medicine point of view. We would might say to yourselves, okay, I hear you have that pain, and yes, it could be gout, but why is uric acid building up in your body? Like
Right.
what's going on with the metabolic processes? And we may not treat the pain right away. We might try to figure out what that root cause is and treat that, instead. So it's really trying to look at the body as an integrated system and how it interplays with one another and addressing those things that might be off balance.
That's very good. Yes. And so I think gout is a really good example.
Oh, good. I just came up with that in the
I
seat of my
think yeah,
pants.
it's really good, because one of the things that for so many years we've all been dreaming about in our lives, particularly at an early age, is the magic bullet.
Hmm.
The magic bullet where you have a condition and you take this pill or get this shot or whatever it is, and boom, the condition is gone, it's over. And so what we find is that the pill is not so magic, and
Right.
and
Doesn't really
and
work
it,
that way.
and a lot of times it doesn't even get rid of the symptoms. It just
Right.
helps you cope with the symptoms a little bit better. And
Hmm.
so, a lot of times in my throughout my life, and even today, we see people who are taking pills for their high blood pressure, taking pills for their problems with glucose regulation, blood sugar,
Hmm.
which is like diabetes, pre-diabetes, particularly the type 2 diabetics. Um, you know, Things like that. You see it all the time. In my work, I see people come in and they're just routinely taking pain medication because that's what they think they're supposed to do, and they have back pain or
Right.
headaches.
Right.
And so, it's a magic bullet type of a medicine, which is disappointing and has disappointed people for so long now that we see a trend where people are starting to wise up, and they don't take headache medication just because the guy on the TV commercial with the hammer bonging the guy in the head. Oh, you got a headache, take this particular medication, and you know the one I'm talking about.
Right.
That sort of thing. So, I know that Aaron does a lot of work modifying people's way of eating, and we don't call it diet necessarily
Right.
because
Lifestyle.
dieting doesn't work.
Right.
If you're overweight and you diet, usually what you're going to do is restrict your calorie intake.
Hmm.
That's the current way of dealing with it. So you reduce your calorie intake way down, and your body starves, and you start losing some weight, and you may lose quite a bit of weight. And so then you fit into your swimsuit in the springtime, and you go to the beach, and you enjoy the sun, and you look better, and you've burned off a lot of that fat that you've accumulated over the winter, and then you come back from your vacation, and then you just continue eating like the way you've always eaten before,
Cycle
and
restarts
and
again.
amazing things
Yeah.
happen. You
Yeah.
start gaining weight again. You start
Right.
gaining 1 or 2 pounds a month or 1 or 2 pounds a week, and next thing you know, you're not only back where you started, but because you went through calorie restriction and you screwed up your hormone systems, now you're even fatter than you were.
Yep, metabolism slows down. And anytime you restrict calories, the metabolism's going to slow down if you do it for a long period of time. Yeah, and I see that a lot, people. And sometimes even really overweight people who've been doing it so long. This is a medical term, no offense by it, but it's called an overweight anorexic. And
Right.
it's because people have they've restricted their caloric intake because they feel like they don't need to be eating that many calories, but it doesn't work, so they restrict more, and or maybe they do lose a little, but they want to lose more, and they just keep on this restriction pattern.
Right.
And after a while, the metabolism is so slow that they never lose anything.
Yeah.
So it's hard. It's a catch 22.
It's really hard, and then what's really disappointing is if it is successful, it's only temporarily successful,
Right.
and it creates more damage than it does good over the long run. So,
Yeah, it
you
can.
may go
Yep.
to your sister's wedding or something like that and look fantastic because you starved yourself for 2 months beforehand, but then afterwards, then you're going to be in worse shape than you were before.
Yeah.
And it's really heartbreaking to see this happen. So this is the predicament that people are in. I mean, other people will take, you know, speed to lose weight or whatever other modern medicine miracles there are, blockers, to
Right.
block,
Yeah.
whatever, and in diabetes, I mean, we see, that people, they may be born without beta cells in their pancreas.
Hmm.
Probably better take some insulin, or you're going to be in trouble. But
Right. Right, but
there are
the
so
type
many,
one, the type
yeah,
one diabetes people aren't the majority of people with diabetes. It's the people who have, they've altered their metabolism with insulin, and it's the type two or adult onset that really is the majority of diabetes in this country.
yeah, yeah. And so that type 2 is oftentimes just insulin resistance, right?
Hmm.
And so
That's
can you
100%
explain?
controllable by diet. Yeah.
Yes, and we see that the first line of drugs they get is a thing that tries to stimulate the beta cells,
Hmm.
pancreatic beta cell production of insulin, where
Hmm.
the cells have worn out. They're exhausted because they've been trying to provide enough insulin to burn all this sugar you've been dumping into your bloodstream by eating all these carbohydrates.
Right.
And so then people take that medication, and it's like it's a stimulant for those beta cells to jump up and struggle some more to produce some more insulin. But
Right. And then you get almost equating it to a feeling of exhaustion with those cells.
oh
Yeah.
yeah,
So then they
yeah,
can't produce it all. It's like they sputter and kind of stop being
fizzle
able to do
out.
anything. Yeah.
Yeah, so then you've lost that, and now you don't have the capacity to produce insulin in the first place, and then you
Right.
get in real trouble. You become synthetic insulin dependent at
Right.
that point, unless
Yep.
you can rehabilitate those beta cells. And so we're just talking about examples of the vicious cycles that people get caught in from going after this disease management model. The
Hmm.
same is true we see with high blood pressure. I mean, people come in and they have high blood pressure, and they're taking a medication for it. And,
Hmm.
fortunately for me, I usually get to see people when they're coming in, they want to get off the medication. They want to try some other alternative because they don't see that medication is healing their problem with high blood pressure.
Right.
So,
Well, and it causes other lot things too. A
yeah,
lot of doctors, they're not even looking at the holistic point of view. As I said, they're looking at one symptom at a time, and they're addressing the symptoms sometimes very well.
yeah,
But it's not looking at the whole body. And a really good example of that is those when someone prescribes high blood pressure medication, just because of the function of high blood pressure medication in the first place and the way it works, is that doctor needs to also recommend and prescribe CoQ10,
you're
and
right.
so many of them aren't. And
Yeah,
when you're on high blood pressure medication, Lipitor or the other the generic versions of that, your body will not produce CoQ10, and then you have a problem with antioxidants, and you know, it's a cascade, and so it's impossible to only treat one symptom at a time and
right.
not create other issues in the body.
Yeah, well said. Yeah, and so I'd like to talk, if you don't mind, I'd like to talk a little bit about my specialties in my
Sure.
work. The the issue of high blood pressure is pretty close to us in our clinic, and so the patient comes in and they want to get off of their high blood pressure medication, and you know the area that where I usually start is taking care of that part of the nervous system which regulates the high blood pressure, which regulates
Mhm.
blood pressure. So
Mhm.
um, there's a nucleus tractus solitarius in your brainstem, and a lot of times there's a dysfunction there because of a misalignment of the neck at the area where it joins your base of your head. It's very close there to that area, and the the vertebra and the base of the head can misalign because there are no intervertebral discs. There's
Mhm.
huge mobility there, potential for huge mobility, so therefore potential for instability and vulnerability to misalignment of the joints. And so
Mhm.
through accidents and injuries, those structures get thrown out of place, and there's tension that's placed there through transference through the dura mater that goes surrounds the spinal cord and the brain. Um, Tension right on the spinal cord and brain stem, and can cause the blood pressure to be hard to regulate. So a lot of
Mhm.
times we see, for instance, I had a guy come in who was hit with a crowbar,
Oh my gosh.
hit in the
Ouch.
head with a crowbar, and his blood pressure was through the roof.
So it just misaligned the whole thing.
Yeah, and
Yeah.
it was a big misalignment. So we're
Yeah.
talking about an extreme example of what can
Right.
happen at that nucleus tractus solitarius. And so what happened was we worked him up, and I did a great job correcting that upper cervical misalignment, and he came in for his next visit, and his blood pressure had dropped from like 240 to 130.
Wow.
Yeah, it was phenomenal, and he felt great.
Mhm.
And then over the course of his treatment, it went down to normal, and of course, he was very happy, and it stayed that way.
So
And yeah,
I was gonna say I have a question for you since we're just
please.
kind of ad-libbing this. So in an instant like that, where it was a very acute injury, a serious injury, but an acute one, did this patient or do patients with similar acute injuries notice a jump in blood pressure that happens suddenly, or would it be something that's progressive and they may not know? I'm trying to see if people listening in the audience would say, well, I have blood pressure, high blood pressure, but it didn't happen all of a sudden, nor did I ever get hit in the head with a crowbar. So I'm
Right.
just trying to make it a little more tangible for people. Would we
Yeah.
notice a sudden jump? Would that kind of person have just a, a an influx that came over a period of time, or how would a person know if their blood pressure is because of a physical misalignment?
Yeah, you won't really know
Okay,
unless you get
it's fair.
examined. All
Mm-hmm.
right. And a lot of times you won't know until after you've been treated. All
Mm-hmm.
right. So that's the difficulty with that question.
Okay, so
Um,
anyone with high blood pressure just should look for cervical misalignments,
It's
though.
for upper cervical misalignment. The base
Okay.
of the head, where it
Mm-hmm.
meets up with the first two bones of the neck, is an extremely,
What you treat me for, actually.
yeah, yeah,
Yeah.
one of the things. And so, what we're interested in that also. What you should know is that my upper cervical professional group, the people that train me
Mm-hmm.
to do this upper cervical corrective care, to do the diagnosis, the very specific X-rays, the very specific X-ray analysis,
Mm-hmm.
the incredible, you know, accuracy of the force that we deliver, which is a very controlled and extremely gentle force. All of those things were taught to me by the National Upper Cervical Chiropractic Association, and one of our doctors, one of our instructor doctors in Chicago area had developed a reputation there, and there had been some experiences through referrals from medical doctors to his practice that the patient's blood pressures were going down dramatically. So the doctors worked with him and orchestrated a double-blind study. It was all done through hospital and medical personnel, except for the chiropractor who delivered the analysis, the diagnosis and corrective care.
Mm-hmm.
Didn't even deliver very much follow-up, and a large number of subjects were studied and followed, and there was an average 17-point drop in blood pressure among the entire group, which was, I don't remember the size, but it was a big group. This was a real, genuine study, and it was accepted and published in the circulation. There's a journal, a medical journal.
Sure.
And so you can look up.
Find it on PubMed, maybe.
Yeah, you can look up the National Upper Cervical Association, Chiropractic Association, or NUCCA adjustment and reduction of high blood pressure.
Mm-hmm.
Now, I just want to emphasize that benefit is not something that can be experienced from just chiropractic in general.
Mm-hmm.
And the chiropractic community at times has claimed success for lowering high blood pressure. So if your chiropractor doesn't do this procedure, you
this
really
upper
can't say
cervical
that
procedure.
this National Upper Cervical Chiropractic Association, this specific upper cervical procedure, even though they might be, quote, adjusting or correcting, quote, correcting, unquote, your upper cervical spine, they can't really claim that chiropractic does this. It's this particular niche, and it's just a handful of people, really, when you consider the world of chiropractic. So I just want to make that clear. But we do use that procedure, and we start there. But of course, we're always interested in getting our patients as quickly as possible to transition off of their ways of eating, which obviously create the high blood pressure. And this is the area where I really love, your input, because you have so much experience with this, and the work that you do really transforms people.
Well, I try. It requires a person who is willing to change.
Yeah.
I can only my knowledge goes so far, right? I can't give people the discipline, which I'm sure they'd want. But you have to be, I've met a lot of people, and sometimes they're in that pre-contemplation stage and that contemplation stage. And until they're really in that action stage, then they're not going to make progress.
Right.
But once they're ready to make changes, like cutting out sugar, cutting out caffeine, cutting out some of the triggers that stimulate the adrenal gland, and the adrenal glands, for your specific, instance to here, we're talking about blood pressure. That's the key. And if you can't calm down the adrenals and really regulate the release of aldosterone, which is one of the hormones that regulates blood pressure, because of the cortisol loop and the other things that are going on in the body. Unless we can address that, which we can do nutritionally. But it requires those changes. And again, some of that recommendations, I'm not going to go into all of them, but the two biggies that people usually kind of balk at is no caffeine, no sugar.
Yeah.
But it really does help. It helps a great deal.
Yeah. And, and I also know, and both of us will recommend variations of the very low carbohydrate way of eating.
Right. I always say low starch.
Well, yeah.
Because garlic can be a carbohydrate, so can celery. So I'm always trying to educate on what the starchy carbohydrates is what we want to keep to a minimum in the diet.
Yeah. I mean, it really comes down to reducing the digestible carbohydrates.
Right.
Because fiber is the carbohydrate, but when you
That's why I say
calculate
starch.
your
Exactly.
carbohydrate intake, you want to subtract out the fiber.
Right.
So it's really nice to talk to somebody who is on the same page with that. And thank you for spending this time with us talking about healing rather than managing of conditions. And
as you said, it's really important. Chiropractic is an important element. Acupuncture is an important element. Nutrition is an important element. And using all three together really helps helps bring you back into balance.
So can we continue this conversation, talk about some other conditions in the future?
Yes, absolutely.
Excellent.
Absolutely.
Well, thank you, everyone, and thank you, Erin. Thanks so much for your time.
You're
and
welcome.
we'll
Thank
be
you.
back in touch soon.
Okay, thank you, Dr. Gruber.
Thanks. Bye-bye.
Bye.